Understanding the gross anatomy of the uterus is important in understanding its function and changes that occur to it during pregnancy, as well as changes during pathology. So, the uterus is a hollow, thick walled, muscular, pear shaped organ in the female pelvis, located between the bladder and the rectum. Its main function are to receive, support, and nourish a fertilized egg, that's an embryo or a fetus during pregnancy, and to expel the fetus at birth. So, what is the location of the uterus? The uterus lies in the pelvic cavity between the urinary bladder anteriorly and the rectum posteriorly. So, this is the uterus here, and you can see the urinary bladder anterior to it and the rectum posterior to it. In most women, it is anteverted, tilted forward on the vagina. You can see it tilting forwards on the vagina here, and antiflex bent forward on the cervix. So you can see how it is bent forward on the cervix, which is right here. So what is the shape and size of the uterus? It is hollow, muscular, pear-shaped organ, as you can see. In a nulliparous adult female, it is about 7 to 8 cm long, 5 cm wide, 2 to 3 cm thick, weighs 50 to 80 grams. That's in a woman who has never given birth before. It enlarges greatly during pregnancy to carry the fetus. So what are the parts of the uterus? We have the fundus, which is the rounded portion above the openings of the uterine tubes. You can see the fundus here, the rounded portion above the uterine tubes. So let's look at the body, which is the main central portion below the fundus and above the isthmus. So you can see the body from here to here. The isthmus, the narrow region between the body and the cervix, that's the site of lower uterine segments in pregnancy. So this part here between the body of the uterus and the cervix here is known as the isthmus. So let's look at the cervix, which is the cylindrical lower portion projecting into the vagina, has a supravaginal part and the vaginal part. The supravaginal part is the part that is above the vagina, while the supravaginal part is the part in contact with the vagina. It's usually visible on speculum exam with external opening of the cervix. So you can see it here. This is the cervix. This is the part that is in contact with the vagina and can be seen on speculum examination, and this is the supravaginal part, the part right here. So what are the cavities and openings of the cervix? Have the uterine cavity, which is triangular on coronal section, flattened anteroposteriorly, communicates with cervical canal via internal opening of the uterus, also communicates with the vagina via the external opening of the uterus, communicates with the uterine tubes at the superlateral angles of cavity. What are the layers of the uterus? We have the endometrium, which is the inner mucosal lining. You can see the endometrium here, the innermost mucosal lining. You have the myometrium, the thick smooth muscle layer responsible for contraction. So you can see the myometrium here. It is responsible for contractions during birth. We have the perimetrium, that's the outer serosal covering, also known as peritoneum, continuous with the broad ligament. So this is the perimetrium here. The perimetrium is the outermost. You can see it right here. So what gives support to the uterus? We have the pelvic diaphragm, made majorly from the levator ani. We have the endopelvic fascia, which is cardinal slash transverse cervical ligaments. You have the uterosacral ligaments, the round ligaments, the broad ligaments is here, which form the peritoneal fold. So in all these are the supports. This is what gives support to the uterus, places it in its normal anatomical position in the body. So what is the blood supply to the uterus? The blood supply to the uterus comes from the uterine artery branch of the internal iliac artery. So you can see the internal iliac artery giving the uterine artery here, supplying the uterus. The venous plexus drains to internal iliac vein. So the uterus is drained via the venous plexus. So the venous plexus here, it drains into the internal iliac vein. So you can see the internal iliac vein here. So what is the lymphatic drainage? The fundus is drained by the para-aortic nose via ovarian vessels. So you can see the fundus here, drained by the para-aortic lymph nodes. We have the body, which is drained by the external iliac lymph nodes. So this is the body. You can see it is being drained by the external iliac lymph nodes. We have the cervix, which is drained by the internal iliac and sacral nodes. So this is the cervix, drained by the internal iliac and sacral nodes. So what is the nerve supply to the uterus? Uterus is supplied by autonomic fibers from inferior hypogastric plexus. That's the sympathetic and parasympathetic supply. So this is the inferior hypogastric plexus giving sympathetic and parasympathetic supply to the uterus. We have sensory fibers follow sympathetic pathway to supply the body slash fundus, and parasympathetic to the cervix. So to quickly remember the parts of the uterus, we have FBIC. F is for fundus, B is for body, I is for isthmus, and C is for cervix. Thanks for listening.